Welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. Thank you so much for joining us. Our guest is Veronica, or Ronnie, Todaro, joining us today to discuss her work with the Parkinsons Foundation, focusing on patient engagement programs. Welcome to the program. Veronica, do you prefer Veronica or Ronnie?
I'll answer to either, but Ronnie would be wonderful. Thank you.
Great,
Thank you.
All right.
Thank you, Neal.
Well, thank you for joining us today. Welcome to the program. Tell us a bit about yourself.
Sure, thanks. Well, let's see. I have been with the Parkinsons Foundation for over a decade, and the journey has been exciting and challenging as we have worked to really improve the lives of people living with Parkinson's. And prior to working with the Parkinsons Foundation, I had worked within women's healthcare arena and really looking again on how to improve the health and lives of women. And this string or the thread that's run through my health career, professional health career, or really a public health career, has been looking at ways to engage the communities that one serves in critical decisions that impact both research as well as healthcare and the support that they receive.
With such a varied background in healthcare, women's health, why Parkinson's now?
Well, I think what's been very interesting is that within the Parkinson's arena, and this really relates to our discussion around advocacy, is that there have been other disease areas that were farther along as it relates to engagement and advocacy of the patient community, such as, like women's health and women's reproductive rights, HIV/AIDS, even heart disease in women. But the Parkinson's community had not really focused on advocacy in a way that truly partnered with, again, what I refer to as the ultimate consumers. And so that's why Parkinson's now, because we are at a place where we can really make a difference in people's lives. And I think I'm sure that many of the people that listen to this show are familiar with patient engagement. It's this new, buzzword. It's the new way to really improve, healthcare and clinical research. And so right now being in the Parkinson's space is very exciting because we can really have impact by including the voices of people with the disease.
When you say patient engagement, are there different levels of patient engagement? And explain how it's much more than simply paying attention to what your practitioner is telling you. Right,
exactly. Well, what patient engagement means is truly being a partner with the patient, or we also at the Parkinson's community shy away from using the word patient and refer to people with Parkinson's as people with Parkinson's. Mm-hmm. And the reason why we're looking at this new paradigm is that by bringing people into the fold in research decision-making and healthcare decision-making, it results in better outcomes. And so when we look at patient engagement, for example, within the Parkinson's Foundation, we're looking at a program called PAIR, Parkinson's Advocates in Research. And the goal of this program is to have people with Parkinson's collaborate shoulder to shoulder with research professionals to look at different touch points within the clinical research enterprise, such as, what are the needs and priorities for research? How are we developing a study protocol? How can we ensure an informed consent form is as good as it can be to make sure that recruitment and retention is where we want to see it? And so what we're doing, and with this specific program with Parkinson's Advocates in Research, is really ensuring that the voice of people with Parkinson's are included. And what's so interesting is that when you engage in this matter, you really see change. For example, we have partnered with various bioscience companies and brought people with Parkinson's to the table and had them engage as advisors. And we've been able to identify modifications in a study protocol that will ensure that a study recruits faster. That's just one specific example of how when you truly partner with patients, you can make change that will, impact treatment and care.
What types of engagement protocols exist? You have people living and dealing with Parkinson's, a complicated condition. How do you get folks to navigate the complicated world of research and trials and things of that nature. Is there some type of a protocol for these folks with Parkinson's to be able to engage effectively with researchers?
That's a great question. And what we have done in terms of ensuring that there's effective engagement is that we have staff who really serve as, let's say, matchmakers or brokers, and make sure that we align a project with the right person with Parkinson's. So, for example, and also every project is unique. So, for example, we have advocates that are payer advocates, Parkinson's advocates in research, who will work with the FDA, and that would be a certain type of individual. You have someone who may serve as a co-investigator on a study, and that would be a certain type of individual. So there isn't one specific protocol. It really is unique to the project and to the outcome that's desired.
How much do you borrow from, say, other industries as far as employment engagement with upper management or with folks on the floor? Are there any similarities, say, with the airline industry, the auto industry, or the tech industry as how you get people dealing with Parkinson's to engage, to want to engage?
Yes, that's an interesting question, and I haven't ever thought about how we may parallel, the work that is going on other industry areas. I will say, though, that this idea of including people with a specific, disease is not unique, and that we, borrowed from the breast cancer community. They had started a program that was similar a number of years ago. So again, what we've done is looked at what is occurring in other disease areas, but not necessarily outside of the healthcare, industry, so to speak.
What type of reception have you gotten from doctors and researchers when you suggest that they work, shoulder to shoulder with the folks that they're going to be doing the research, trying to help?
It's very interesting. The response that we've gotten from researchers has been tremendous, as a matter of fact. And I can give you a specific example. Is that within the Parkinson's Foundation, we one component or one tenet of our mission is to better understand Parkinson's. And through that, we fund, investigators and their projects. And we've pulled together a group of grant review panel, and include people with Parkinson's in this panel. And initially, some of the researchers or the scientific community is skeptical, in terms of being perhaps not as comfortable as they wish to be in sharing insights or thinking that what they may say will be too harsh for a patient to hear directly in regard to the disease and progression. But what we found is that, the person with Parkinson's will sit in the room and really share that gem of information, or that one piece that will be an aha moment where you'll say, I never thought of it that way. And so we've done surveys of researchers after they've participated in a patient engagement experience, let's say. And, time after time we hear how this has changed their perspective. And we've also heard that they will do this again on their own. We have to remember that there are two experts in the room. One expert is a researcher, a medical professional. Someone has dedicated his or her career to this. But the other expert is someone who's living with this disease, 24 hours a day, 7 days a week.
We'd like to get some more information. Where can we go online and learn more about how to better facilitate patient engagement across the board?
Well, I would encourage people to go to our website, www.parkinson.org, as well as people should feel free to call at Helpline, which is 1-800-4-PD info, or 800-473-4636.
Right. Appreciate your time and coming in and speaking with us today.
You're welcome. Neal, thank you for having me. It's been a pleasure to speak with you. I've enjoyed our conversation. Thank you.
Looking forward to more. Thanks so much. You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. Subscribe to this podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page when you visit us at hpr.fm and healthprofessionalradio.com.au.